Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, March 16th, 2021. And let's just start out by saying that we have now been doing these COVID Facebook Live updates for you for 1 year. We started a year ago. It was actually the March 16th a year ago. Obviously, this was the time when everything was being shut down. It was also actually the first death here in Chicago. And it was the day that we started doing this. I had never done a Facebook Live. It was not something the city did significantly, but if you remember back a year ago, there was so much uncertainty about COVID, and we really felt strongly about trying to make a platform to take your questions directly, try to answer honestly what we knew, what we were still learning, and try to keep people up to date. So at the beginning there, we were doing these Facebook Live 7 days a week. I want to really thank the team that has been filming these for a year and the people who have helped with promoting it and helping us figure out the social media platforms. And we've continued doing them for a whole year now, not 7 days a week anymore, but multiple times a week. And I hope that they have been helpful to you. Certainly, they have been a good opportunity for me to hear directly from you about what kinds of questions are on your mind. It's been helpful for me to think about how to try to translate the science into things that everybody can understand. And if you are watching today and you've been watching for a year, thank you for hanging in there with us. All right, so as always, you can put your questions directly in the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter, and we will take your questions directly. But let's start, as always, with looking at our data. So chicago.gov/coronavirus is the one-stop website for everything related to COVID, and then you can get to the dashboard directly on chi.gov/COVID-. So let's pull it up. A month now of pretty flat numbers. You can see our positivity is sitting at 2.9%. It's up from 2.8% a week ago. It was 2.7% for a few days. It's been sitting just under 3% now for really a few weeks without a lot of moving. Similarly, our tests, we're averaging just over 11,500 tests per day. That's also been quite stable for a few weeks. And then our cases are at 283 per day. We've been in the 270, 280 range pretty consistently here, again, for a few weeks. So especially that case number, we really would like to get it down under a 7-day average of 200 cases per day. That would take us down out of the moderate risk and start pushing us toward lower risk territory. But broadly, things are holding steady, and then our vaccination numbers have been improving really nicely. If we look quickly at some of the daily demographics, one other good piece of news is that our deaths are down to averaging just 3 per day, and that is getting back to really where we were over the summer. That's a 7-day rolling average. And where you think about at the peak of the first wave, we had almost 50 deaths a day from COVID here in Chicago. And at the peak of the second wave, we had almost 25 per day. The fact that we are back down to seeing 3 deaths per day, 3 deaths a day is still too many, don't get me wrong, from a COVID perspective, but compared to where we were, it's really good progress. And our hospitalization numbers, our ICU numbers, our ventilator numbers, our emergency department numbers, all of those continue to head in the right direction. And then we're doing a good job vaccinating. We are at again, we're hitting all of our efficiency numbers. All the vaccine that we're getting is getting into arms quickly. And we're at now 18.3%, not including vaccine that came in yesterday. 18.3% of Chicago overall has gotten a first dose. 23% of the adults, so 18 plus, who are eligible, have gotten a first vaccine. And then the one I'm a little more concerned about is where we are in our seniors. Obviously, in March, a major focus here in Chicago has been getting seniors vaccinated. People who are 65 and older clearly at the highest risk for severe outcomes. But unfortunately, despite a lot of work, and I'm happy to answer questions about it, and I want to thank everybody who's been hosting Senior Week events, bringing senior events into communities, all of the work that we've been doing, by the end of the month, we will have brought teams to every senior living facility in Chicago. We are doing, obviously, the homebound senior work. There's been a lot of work reaching seniors. However, again, not counting what came in yesterday, we were only at 45.5% of Chicago seniors having been vaccinated. And my goal is really for the next couple of weeks as we close out March here, really trying to get seniors vaccinated. So just as a reminder, seniors get top priority at the United Center anywhere that you live in the city of Chicago. If you are 65 or older, you can get vaccinated at the United Center, and you can call the call-in number to make that appointment, or you can use ZocDoc if you're able to get an appointment. Those go very quickly. And really, we've been encouraging all of our providers to make sure that they are getting people who are 65 and older done quickly, and really upping the outreach in every way that we can. But if you know someone who still has not been vaccinated, who's a senior here in Chicago, please help them get an appointment either at the United Center, through a provider, or through other channels. And that's the one we'd really like to see the most progress on in the next couple of weeks. Okay, so let's go ahead and move into some of your questions. Carol O'Grady on Facebook. How long after the second shot am I fully immune? So you're considered to have the full protection that you're going to get from the vaccine 2 weeks after the final dose of your COVID vaccine series. So if you got either Moderna or Pfizer, 2 weeks after that second dose is when you're considered to have the protection from the vaccine. If you get Johnson & Johnson, which is a single dose, 2 weeks after that single dose, you would consider to have the protection. So, and you'll note that I'm using the term to have the full protection as opposed to fully immune. It's a fantastic vaccine, right? The Pfizer and the Moderna, 95% protective against COVID, but there is no such thing as 100% immune against COVID. And so that's just the difference. But it's really good. And once you've been fully vaccinated, 2 weeks past the second dose, that's when we talk about, for example, you being able to gather in small settings with other people who are fully vaccinated 2 weeks past that second dose. Your risk goes down significantly. You're not subject to the requirements of quarantine with the travel order, et cetera, et cetera, et cetera. So that's the timing. Good question. Lacey DeFace on Facebook. Why isn't the United Center being used for all of Cook County? Why do you have open slots at the United Center for specific zip codes, but not the groups that people are assigned to? Okay, so let's talk some more about the United Center. Just for some context, I do want to remind people that we're excited, obviously, to have the United Center here. It is a relatively small amount of vaccine compared to the amount of vaccinating that's being done across the city and certainly across the state. We're doing a maximum of up to 6,000 doses will be the maximum there at the United Center. And that's in the context of more than 100,000 doses that are happening across the state of Illinois. But regardless, I know there's a lot of interest in it. So the United Center is being used 30% of the doses, 30%, sorry, let me start over. 60% of the doses at the United Center have been held for City of Chicago residents. 30% of the doses at the United Center have been held for suburban Cook residents outside Chicago, and then 10% of the doses at the United Center are being used for people who live even outside suburban Cook. The way that is actually happening is that, as you'll recall, when we first opened up, the top priority everywhere is to get people over 65 done. And so people from all over Illinois were able to sign up for those 65 plus appointments. The state of Illinois is planning to take the remainder of its allocation and likely bring it to some areas of the state that have been under vaccinated. That's my understanding, more of a mobile approach. I really can't speak to that detail, but it's a relatively small amount of vaccine. Most of the 10% of the appointments that were allotted to the state were taken up by people over 65 signing up in those first few days, which is great. Both Cook County and the Chicago Department of Public Health are working. Remember, first, we want to make sure here in Chicago, anybody over 65 can get an appointment. There's been a lot of work, happening behind the scenes to make that happen. And then secondly, we are prioritizing appointments for people who live in these under-vaccinated zip codes. Where those appointments don't fill, where they get canceled, they go on ZocDoc. So if you do not live in one of those zip codes that's getting prioritized for an appointment, please do not try to, game the system, find a voucher, et cetera, because we're canceling people if they use the systems that we have, and you testify that you live, you attest that you live in one of these zip codes. We are putting appointments on ZocDoc every day. Not a lot, but there are appointments going up. And if you don't live in one of those zip codes, that is where you can look for them. But remember, this is an 8-week engagement for the United Center. We're 1 week in as of today, and once we get further down the line, there's going to be more eligibility and certainly more vaccine. So we're not having any trouble filling appointments at the United Center. I want people to hear that. And if at any point there are appointments that we need to make sure we can fill, they will go up on ZocDoc. And like every day, like we put some up on ZocDoc yesterday and they were gone within 2 minutes. So I don't want to imply that there's huge numbers of appointments available because, again, people over 65, if you know someone 65 plus, please help them get an appointment. They can call the call center, and we can get them that appointment. 312-746-4835. City of Chicago residents only. That's for people over the age of 65, or if there are people who are living in these zip codes, for example. If you are not over 65 and you don't live in one of the prioritized zip codes, ZocDoc.com/vaccine is where you should look. And not just for the United Center, but for any appointment that's available outside. But remember, we are on track. We're expecting to move ahead to 1C more formally in just a couple of weeks, March 29th. And we'll be making some more detailed official announcements about that tomorrow. But as more eligibility and especially more vaccine gets here, more eligibility opens up, there will be more opportunities. Broadly speaking, if you have an underlying condition, you're going to be able to get a vaccine in April or May, a lot of you in April. But please rest assured that the month of March is mostly about trying to get our seniors done. Kim Garrity from Facebook. When will there be more J&J in Chicago, Cook, and State? Yeah, that's a great question, and I would love to have the answer to it. So, as you might have heard me say last week, we got a one-time allocation of J&J a couple of weeks ago, and then we didn't actually get any for another couple of weeks. There is a little bit that is just starting to come in again, and we're making that available through providers. We're using some of it out, for example, where we're doing essential workers out at the airport. And we do absolutely intend, as J&J becomes more available, to be able to have it more broadly open to the public. So my understanding is that we are waiting for the FDA to give the final thumbs up to the really large-scale production facilities that have been stood up. The Moderna and Pfizer vaccines that are mRNA vaccines are a more specialized method of production, right? You've heard us talk a lot about the ultra cold and the freezer, and it's a more complicated way, if you will, of making a vaccine. And so although we were getting a fair bit of that, that also has not seen the major increases, particularly in recent weeks, that everybody would like to see. J&J, on the other hand, is made more in a more traditional way for vaccines. It's more similar to the way that we have made large volumes of vaccine before. And so there are vaccine production sites around the country that can be used, can be more easily adapted to make the J&J vaccine. And so, for example, I was really pleased that the Biden administration basically got Merck, who is normally a competitor of J&J, to agree to help make the J&J vaccine. So as soon as the FDA gives the approval that these larger mass production sites are meeting all of the requirements, we obviously have to make sure that all of the safety steps, right, like it's all being made very appropriately. That should come really in the next few days is what we're hearing, by the end of the week. Assuming everything checks out there, we should start seeing quite a lot more J&J starting as soon as next week, or certainly by the very last week in March. And I actually think we're likely to see quite a lot more J&J, particularly in April and May. And that'll be good, because where we think about a lot of these essential workers who are going to become eligible when we move into 1C, and people who are looking to get one shot and be done, the ability for us to have more of that single dose vaccine is something we're definitely excited about and looking forward to. So I don't have any control on when J&J gets here. It's when it's allocated from the federal administration. But what we're hearing is that likely in later March, so possibly just as soon as the next couple of weeks, and certainly in April, we do think there will be quite a lot more J&J, and there will be more opportunities, I expect, for the public broadly to be able to sign up for vaccine. I know it's hard to imagine right now, where it still feels like, oh, I've been wanting to get a vaccine and I can't get an appointment. But, some of you heard, and I see there's some comments here that, wondering about, where President Biden said, I want to make sure that, we can broadly open up to all Americans by early May. That is because they are feeling very confident that there will be significant vaccines. So that really in April and May, I do think we're going to get to a point here where everybody who wants to get a vaccine appointment is going to be able to get one. So it's not too much longer. When we do make that move into 1C, which of course we're actually on the same timeline that we said right from the beginning. I think we estimated pretty well there, where we look at how much vaccine we've been getting, how much we expect to get over the next couple weeks. Again, the push right now, getting those seniors done, getting some of those frontline essential workers that we've been focused on. We've been doing the CTA workers, for example. We've been doing some of the manufacturing folks. That next move ahead is going to be a big opening in terms of eligibility, and I think the vaccine supply is going to rise really over April and May to help meet it. Sandra Garcia from Facebook, how long do you have to wait to get the vaccine? I'm getting over COVID on my 11th day. All right, well, I'm glad you're getting over COVID. So a couple things. One is you need to obviously be over COVID. So you have to have, just as a reminder, if you've been infected with COVID, the minimum amount of time that you have to stay isolated is 10 days, and your symptoms need to be basically resolved, right? Your fever needs to be gone. You need to be feeling better. Once you are post-COVID and no longer infectious, you can get the vaccine at any point. There are people who are deciding to wait up to 3 months, because certainly after you've had COVID, there is some level of natural protection that comes. And so if people want to wait, they are welcome to. But where people have been asking me individually, I had COVID 2 weeks ago, should I get the vaccine? I say, obviously it's your decision, but my recommendation would be that if you have the vaccine open to you and you have an opportunity to get vaccinated, you should take it. So here's Beth Mara Kessler from Facebook. Do you have the intention of meeting Biden's promise of access to everyone by May 1st? So assuming that President Biden can come through with the amount of vaccine that would make that possible, yeah, certainly we would follow that. I intend, we've said, if you recall, and if you look back at our website, we really from the beginning had laid out as our tentative timeline March 29th to move ahead into 1C, and then we had actually said in the end of May, more like May 29th, to move ahead into phase 2, which will be open to everybody. I think given that the administration is feeling very confident that there will be enough vaccine to be able to more broadly open it up, I think what's likely is we will move up the timing. We probably won't wait till the end of May to open till phase 2. It would probably be more like the very end of April. But I'm not going to make a commitment on that one way or the other yet, because I do, as always, I want to actually see the vaccine and know that we have enough vaccine to be able to meet that. When we move ahead, priority will remain for groups that are not done, right? The priority would remain for that 1C group, even if we do more broadly open up. But, I really, again, I know it's hard for people to imagine right now if you've been wanting to get a vaccine and you're anxious about being able to find an appointment. But we really are hearing, and I think these statements at the federal level are reinforcing that there's just going to be a lot more vaccine in April and May. And so I think, if you look closely at really what Biden said and promised, it wasn't that everyone would get vaccinated by May 1st. It was that he wanted to have eligibility opened up, and so people would be making appointments, for example, in May, and then maybe vaccinated more sort of in the summer timeframe. But yeah, I think assuming that there is actually vaccine that can back up that asks, we would be thrilled to be able to open it up more broadly. So more to come about that. Ari Aidney from Facebook. Chicago won't fully open until at least 1C. We'll move to 1B plus, she asks. I'm in 1B plus. I'm concerned about Governor Pritzker's Illinois Phase 5 plan. Okay, so there's a lot of different questions in that. So Ari, let's take these kind of one at a time. So first of all, right now, we have said, in these last couple of weeks of March, if there are appointments that are not filling with people who are in 1B, who are not filling with seniors. We've said to providers that, if they're not able to fill all of their appointments with people who are over 65, they can start vaccinating, people in that 1B plus underlying condition. But we are intending March 29 to move ahead with 1C, which means moving ahead to the people who have the list of the underlying conditions, as well, to be clear, as the frontline workers who are unable to work from home. So I feel pretty strongly about making sure that people who are working in restaurants and people who are, clergy and people who are working in, doing your hair and the nails, people who have trouble keeping the distance, who can't work from home, we want to make sure that they have the opportunity to get vaccinated. We have plans to be vaccinating, particularly in some of the settings that may have a lot of lower wage workers that may have more difficulty accessing vaccine. And so we are planning to move ahead, like I said, and I think we're going to do a formal announcement about this tomorrow with a lot more of the details, more at a press conference. So you can watch for that, and we'll be getting some more information up online about this. But I want to separate this from the governor's Phase 5 plan, okay? So the governor's Phase 5 plan related to reopening has to do, and there are going to be, my understanding is, some more information that will be coming out from the state really very shortly about this. But the phases of vaccination have to do with when do we have enough vaccine to be able to open it up more broadly. We obviously, every single dose of vaccine that we are getting is being used. No vaccine is being wasted. And I want to make sure that we can open things up in a way that helps prioritize people who are at highest risk in terms of underlying conditions and who are at highest risk related to the kind of job that they are doing. And again, not everybody's going to be able, if we open March 29th, there's nowhere near enough vaccine to vaccinate all those people on March 29th, but people will be able to get vaccinated in April and May. Just like when we moved from 1A to 1B, we said, that was at the very end of January. We said most people are going to get vaccinated in February or March in 1B. That's exactly what's happened, and that's going to be the same thing in 1C. We'll open up at the end of March. Most people in 1C will get vaccinated in April and in May. And so the Phase 5 reopening plan is more about what are we doing. It's not about the phase of vaccination. It's about where are we in terms of having a high percentage of the population vaccinated? Where are we in terms of our case numbers, our hospitalization numbers? How well have we done on getting seniors vaccinated? Again, another reason to make sure we're really getting seniors done really aggressively in the month of March. And so, assuming things keep heading in the right direction from a case perspective, that's part of what allows us to move ahead in a reopening way. So I know it's confusing because there's the phases of vaccination and all of these letters and numbers I know can be confusing to people. But in terms of vaccine eligibility, March 29th, 1C, we will be opening up just as planned, and then the governor's Phase 5 is about what does this summer look like more? When are we able to do some more broader reopening? And we've been having conversations and certainly looking forward to being able to share out some more details. But you've heard us do some of this already, right? Like April 1st, that's 2 weeks from now, opening day, baseball, right? 20% of the fans are allowed back with the appropriate things in place. We've been doing some careful planning for this summer, assuming that our numbers continue to be stable or decline and that we continue to see really good uptake in vaccine. I fully expect that this summer is going to look, more like 2 summers ago than last summer. But we are, I want to be clear that Europe is seeing surges in COVID again, despite the fact that they are also rolling out vaccinations. And it is not a for granted that we're not going to have any more trouble here. As each week goes by and our numbers are holding and people are, for the most part, really not trying to pretend like COVID is over, and recognize it's not that much longer to hold on here. If we can get more of the population vaccinated, we'll be in good shape. Okay, so Mark Weiermuller on Facebook, should expectant moms get a vaccine? So what we have been encouraging here is that expectant moms really talk with their OBGYNs. There were not pregnant women formally included in the trials, right? When they were testing these vaccines, they did not include pregnant women formally in the trials. That said, there were women who got pregnant in the trials and they did not see bad outcomes related to the COVID vaccine. And then similarly, the CDC has been tracking everybody who's gotten vaccinated, who's willing in this registry. One of the first questions that they ask you is, if you're a woman, are you pregnant? And there has been work to sort of follow up with this. So, I personally, when I've been talking to my friends, et cetera, I have been encouraging them to get the vaccine because we know that pregnancy puts women at risk for more severe outcomes from COVID, right? If someone is pregnant and they get sick with COVID, there's a much higher chance that they may get severe COVID, could get hospitalized or, God forbid, even die. And so the risk of severe COVID generally thought to be higher, certainly, than there is no known risk related to pregnancy and the vaccine. It's just that pregnant women were not formally part of the trial. So I encourage women who are pregnant, have this conversation with your OBGYN, and they can help you make that decision related to timing, et cetera. But broadly speaking, you'll notice that pregnancy was actually one of the categories that we listed and the CDC recommended as listing for prioritization when we were thinking about underlying conditions, just given that risk there. So I certainly have friends of mine who have gotten vaccinated while they've been pregnant, but I want to make sure that where you've got questions, you're getting those answered, and you should talk to your doctor about that. Jen D from Facebook, can other essential workers be vaccinated at the O'Hare facility or just CTA and airline employees? So at O'Hare right now, we are focused on airline employees. There's actually a separate thing that's happening with CTA. We've been working hard to get the CTA folks all vaccinated, but these are still what we call sort of a closed pod, right? Most of what we've been doing with all of the essential workers has not been. Right, this is the difference between saying teachers can get a vaccine wherever versus like teachers are going to be vaccinated in these ways, in these closed pods. And our main priority for a lot of these essential work groups is really to do it in a more closed way. So as of right now, they are very focused on employees at the airport. There are a lot of them still to go. The plan is actually to open it up more to more transportation there. We're probably going to have some of the taxis and Uber and Lyft and other types of transportation also use that site down the line, but we need more vaccine. We didn't get more J&J vaccine. And so until we have significantly more vaccine, we're not able to open that up even further. So where there are essential workers that we have a particular focus on, we tend to bring vaccine to those employment settings. We've been doing strike teams, bringing vaccine to food manufacturing settings where we saw outbreaks, to other kind of larger factories where we've ever had outbreaks or where we have concerns about COVID spread. That's where we've been bringing kind of in a strike team focused way vaccine. And as we start to move ahead in the same way that we have worked to bring vaccine to CTA employees, we've worked to bring vaccine to police and EMS and Chicago Fire Department. We've worked to bring vaccine to grocery stores or invited them in with a code into pods. We've worked to bring vaccine to childcare workers or invited them into the pod. We've worked to bring vaccine to schools and people who work in education centers or invited them into the pod. It's that approach related to essential workers is how we've managed to continue doing some prioritization for some of the highest risk. And as there's more vaccine, we're going to get to a point where it's not going to be hard to find an appointment to get vaccinated, and everybody will be eligible at that time. So Marianne Mizal, Hidalgo from Facebook, wondering about AstraZeneca. So AstraZeneca has not, as I think you know, been submitted to the FDA at this point for consideration for emergency use authorization for use here in the US. There are ongoing trials, and I anticipate that it likely will be presented to the FDA, maybe at some point in April. AstraZeneca has been in the news a lot these last few days related to decisions that were made, especially in Europe. They're wanting to look at some more safety related to the potential of blood clots. Wasn't seen in the trials. There's some follow-up related to it. I want to be really clear that based on everything I've seen, there's not been a clear link at this point related to blood clots and AstraZeneca, but there have been, decisions made by some countries to sort of put that particular vaccine on hold, or to not offer it at this time if they've got other vaccine available while they're looking into that some more. AstraZeneca is also the vaccine that South Africa had decided not to move ahead with because they had seen some less protection related to the variant that first emerged in South Africa. So I'd say it's a vaccine that in European settings is getting a lot of extra scrutiny, and certainly the trials have been happening here in the U.S., like related to what does COVID look like here? What are the exposures like? And I will, if AstraZeneca does put forward an application to the FDA for emergency use authorization, just like we do for every vaccine, the FDA, the CDC, us, everybody would be looking really at the details of that. I would really, really like to get another vaccine available. Certainly getting a lot of people vaccinated here is good. If any of this is substantiated related to that there's actually a significantly increased risk of bleeding or there's other safety concerns, the FDA would not approve this vaccine, just to be clear on that. But if that's not something that's seen in any of the studies, and if the efficacy continues to look good against the strains that we're seeing broadly here in the US, I would certainly welcome another vaccine, but it's premature. Nothing has been submitted at this point. The trials are still ongoing, and there hasn't even been a date put forward, to the best of my knowledge, around when that might be. I think where we were looking at the trials, the two main vaccines that are still, I think, have a good possibility of potentially being additional vaccines available here in the US. One would be the AstraZeneca and the other would be the Novavax. And I think the AstraZeneca, April would probably be the earliest that we might see that data and possibly have it as another option. And Novavax is a little further behind that based on what they know with the trials, so in May. Let's see. All right. So, couple questions related to homeless. Lincha Delu Slovak on Facebook, asking about, will the homeless get vaccinated? Many are in the trains, they're vulnerable, they've been vaccinating at shelters, but I want to know when other homeless communities can be helped. Yeah, thanks for that. So you're right that we have already, right at the beginning of 1B, homeless people who are experiencing homelessness were one of our top priorities related to strike teams. So we were out vaccinating with many partners in all of the homeless shelters, but actually we also did start doing some outreach to people who were in encampments and wanting to make sure that people who are not in shelter but are unstably housed can be vaccinated. And with J&J here, again, a single dose, that does become much easier. And so one of the ways in which we are using the J&J, the limited amount of J&J vaccine that we've gotten to date here in Chicago, is that we have made it available through some of the partners who do homeless outreach specifically, including on the trains, so that they're not vaccinating people on a moving train, but if they come off the train and they're doing some of the assessments like they'll do, they can offer vaccination, get the information, and get folks vaccinated on the spot. And similarly, additional outreach to the encampment. So we've actually done very well from making sure that people who are unstably housed can get vaccinated. We know they're at high risk, very hard. When they are kind of in shelters, it's these high risk settings where we've seen a lot of outbreaks. So that has definitely been a focus. Aaron Hoffman on Facebook. Since the government is already buying enough vaccine for every American, why do we need additional new vaccines like AstraZeneca, Novavax, et cetera? So it all has to do with how much these companies can actually produce. So, you heard me say that Pfizer and Moderna, everybody would love more Pfizer and Moderna, but in terms of the ability to more quickly increase a lot of Pfizer and Moderna, it sounds like it's just not feasible in a short-term kind of way, even with all the resources that have been going in. And so part of the reason about being able to also bring other vaccines in, like potentially AstraZeneca or Novavax, is that it increases our speed if there is more vaccine available. I also think, frankly, that the federal administration is thinking about, first and foremost, wanting to take care of the Americans. But we are in a global society here, and you've heard me say my biggest concern, really in a lot of ways related to variants and our long-term progress, has as much to do with what happens internationally and whether we're able to get vaccine allocated across the world. And my sense is that will be a high priority of the federal administration from a security standpoint, frankly, once we're able to make sure that there's enough vaccine available for all Americans. And so we need, getting new vaccines is a good thing. There are different vaccines that are going to be more useful in different settings. Where you think about internationally, something like the Pfizer vaccine with this ultra cold storage and the really careful ways it needs to be mixed, that is not feasible for trying to do more rural parts of the world where keeping things cold can be a challenge. And so some of these vaccines that have more flexibility in terms of production, in terms of price, in terms of cold chain, I think are going to be really important. And, we are still seeing what happens with these variants, right? There is still some possibility that down the line, we may need to get a booster dose related to variants that have emerged. And having strong, solid vaccines that, every one of these vaccines has been shown to be, nearly 100% protective against hospitalization and death. Like, amazing. I don't just mean the American ones, like the Chinese ones, the Russian ones. They're all showing as being amazingly protective against the severe outcomes. And being able to have really widespread global vaccination here is actually part of our strategy. Even though we're very focused on Chicago right now in the US, we do need to think sort of in that broader term. So those are other reasons why getting other vaccine platforms for this is important. I'm not worried about vaccines going unused, right? Where you think about all the people that are gonna need vaccination. All right, I think we are just about at time here. Let's go ahead and turn to some good news here. There's some more questions I'm just seeing related to some more of the 1C and the reopening plans. Any reopening plan, we in the city, we will be certainly in conjunction with the state. There will be, you won't miss it when there are announcements about that. We've been doing a lot of planning. We're trying to be as coordinated as possible, certainly here. So you'll be hearing some more about that. But we are feeling optimistic, assuming that people can continue to be patient just a little bit longer, and that we can really keep seeing the nice increases in vaccination that we've been seeing. So in terms of some good news, the the Chicago Department of Family and Support Services, DFSS, in partnership with what's called the Cities for Financial Empowerment Fund and then Heartland Alliance, has actually launched, I think, a really good initiative. It's a free financial navigators program to help Chicago residents deal with the financial impact of the COVID-19 pandemic. So obviously, this has hit people in all kinds of ways, but it has hit a lot of us here in Chicago financially. And if you are needing some help to strategize around, how to support disruptions to your income related to COVID, there are trained financial navigators that will provide over the phone structured guidance free of charge. So if you are interested in getting some support around that, you should call 773-799-9062. That's 773-799-9062. There's also an online interest form. You can find it through the coronavirus website or through the Department of Family and Support Services website. So I thought that was a good new initiative, even as we're thinking about recovery at the city level, certainly knowing that a lot of people have had and continue to have disruptions to their income. So that's a good option. And then I think maybe just the last thing is that, we are vaccinating thousands and thousands and thousands of people through the United Center. I want to give a shout out to all of the interpreters who have been helping there. We've had more than 1,600 on-site sort of translations there, and we've got people in person who are helping where there are folks coming in who are speaking any language other than English, really making sure that they're getting the support, and I've gotten some really nice feedback from that, so thanks on that. We've also got a lot of additional support. We've brought in, more wheelchairs, more waiting space for companions. We've continued to really make adjustments there, and broadly, that it's going well in terms of really being able to get a lot of the most vulnerable Chicagoans through. And it's additional vaccine, certainly. I know it's frustrating for those of you who are trying to get an appointment and feel like you can't. And most of you, if you are in that you have an underlying condition, you're going to be able to get an appointment in April. And after we open up there, ZocDoc.com/vaccine remains the place where you should go for any publicly available vaccinations. We do post, some up there basically every day. It's not a large amount typically, but where we have any unused appointments or cancellations, or we're not filling vaccine, and we just want to make sure that we're trying to provide some. That is where you can go. And also, if you've got these underlying conditions, your providers are going to start reaching out, scheduling for their highest risk patients, starting to get some of those folks in. So as more vaccine continues to get here, I'm glad that you're feeling excited about getting vaccinated. But if you know somebody 65 plus, please, 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 we've got to get them vaccinated, especially in these next couple of weeks. You can call that number for the United Center. You can go through providers. Everybody has been instructed to prioritize people 65 plus first. So that is my biggest ask to everybody, because that's going to be tied to reopening. That's going to be tied to us being able to really feel safer in a moving past COVID way. And we've done, a lot of really amazing senior-focused events around the city. Thank you to all the partners who have been part of that. We've had these 500-person senior events all over the city, brought in a lot of folks there. We're going to keep doing some more work there, keep doing some more work through the faith community, keep going with the Protect Chicago Plus has been going well, keep bringing the strike teams out, all the things that we've been doing. But please have a conversation if you know someone who's older, and let's get them an appointment. And again, if they're worried about coming in to the United Center, for example, you can come with them as a companion. We've got translators. They don't have to walk long distances. The parking's free, and we've really been working hard to try to make that as supportive as it can be for people who are older. So with that, I will sign off. We'll be back on Thursday, I believe, with Dr. Sybil Madison, per usual. and happy 1 year of Facebook Lives. It's been a long 365 days, but I hope you found this platform helpful and informative. It's really our goal, just to try to answer your questions and bring hopefully a little bit more clarity into what I know has been just a year of a lot of uncertainty and a lot of questions, and right now a lot of anxiety around vaccines. So thanks as always for tuning in. We'll see you back on Thursday.